You're listening to the Joy Tax Podcast, a conversation series for parents and caregivers raising a child or teen with complex chronic conditions. The normal parenting wisdom doesn't fit the situations we are living through. This is a forum to share, affirm, and learn from each other. It's also a window for allies to listen in and gain deeper insight into the world we inhabit. This podcast is not a substitute for medical guidance. We encourage you to always talk to your healthcare provider before making any medical decisions. Welcome. I'm Mercedes Harness, the host of the Joy Tax podcast, and I'm here today with Dr. Elham Raker. Thank you so much for being here. Dr. Raker is a pediatrician and a mom of a daughter with long COVID. And I've asked her to come on today to talk a little bit about how we can better advocate for our kids in the doctor's offices, and also to share her experience as being both a mom and a doctor with a chronically ill child. So, welcome. And can you just begin by giving us a little bit of a background of what life was like before your daughter got sick and what it's like now?
Thank you for having me. And thank you for doing this. I know a lot of parents are just kind of lost, and it's nice to have that community
Mhm.
um, that we're all trying to provide for each other. Um, what was life like before? So I have two children. My son's a couple years older than my daughter, and life was active. It was sports and school and going from one thing to the next, especially my daughter. She was the go, go, go kid. Um, it was not as active right before because of COVID, the COVID lockdown. So we were in COVID lockdown for about right, in 2020. And then as things started to loosen up, she got sick in 2021 in December. And her symptoms began in February of 2022. So, but, I would say the average family life of two active kids doing school and sports and friends and life and all the things.
Mhm. And what is life like now?
Um, It's been up and down. So, like I said, it started in 2022. So, it's been 4 years. And we've had different phases of the illness. Um, Obviously, in the beginning, it was a lot of what is going on. Um, Very hard to know that this is long COVID, obviously, when it first started. And especially 4 years ago, it was even less information. Um, so it was a lot of, her first symptoms were headaches, massive, massive headaches. And it was after she started presenting with other symptoms that we realized more and more organs and systems are involved, that there had to be something unifying all of this. And that's when we really had to, just thought this has to be long COVID. And back then we were checking, so we knew that she had had a COVID infection. So it wasn't hard to put it together. Um, those first few months, she was still going to school, but missing chunks of school because of these headaches. And then it was summer, and we got the advice of, just take it easy and eat well and rest, and you'll get better from a long COVID clinic. And that was not necessarily true.
Mhm.
Um, and we found out a lot of things that we learned from being on Facebook groups. um, and she slowly improved after we went to a clinic in Denver. And lots of therapy, physical therapy, occupational therapy, mental health therapy. She was homeschooled at the time, and over the course of the next 6 months ish, she started to improve. So that was one illness, and she went back to high school, or she started high school. She was in eighth grade at that point. She started high school full time with a lot of accommodations, a lot of safety guards in place, but she was doing okay. She was able to attend school all day. That December, her freshman year, she got her second COVID infection. And 4 weeks later, we were right back to square one. So I feel like we've lived two different illnesses. I feel like we've lived just two different or multiple different illnesses, to be honest. I mean, every day is different, right? As you know, it's one day it's a headache, one day it's a stomach ache, one day it's all of it. So many things come up and can affect your day to day. You have no way of predicting, you no way of knowing, and you
Mhm.
just have to be prepared for all of it. So she's gone from homeschooling to partial schooling to full schooling to back to partial schooling. Now we're on back to a hybrid schedule, which she's been able to maintain. But some days, even that's a struggle, and we have to cut back. So um, the inconsistency has been our consistency.
I can relate to that. When you say a hybrid schedule, what does that look like?
So she goes to school later, and that she has a full day actually, but she's gotten permission, quote unquote, to miss her first period. Oftentimes she'll miss her second period too. So we just let her teachers know, and she has her accommodations in place. But it's hard because then she's trying to play catch up and
Mhm.
keep up with that and the stress of that. So it's not ideal, but I feel that her being there for lunch and recess and being a part of the school environment was also very important
Mhm.
mentally.
Mhm.
So we've really tried to maintain that as much as we can. She plays her sport to some extent, not as much as she would like. She plays water polo, so being in the water is actually good for her. So yeah, we just do the best we can with what we got on the day that it presents.
You mentioned that when you took your daughter to a long COVID clinic, that you
Yeah,
were basically told to let her rest. We
yeah,
had a similar experience, although we weren't at a long COVID clinic. I waited a long time to take my daughter to the doctor because I thought, well, sometimes kids just get sick for a long time. And then we were
yeah,
told to rest. And I often think back to those early doctor's appointments, and I wonder what I could have done to have communicated our distress better because as her file got bigger and the more I took her in, the more we were dismissed in a way because
yeah,
I was just a paranoid mom. And, I
yeah,
didn't take her to the doctor. We tried to stay out of the doctor's office during the pandemic and even before. So as a pediatrician, how can we help parents know how to advocate for their kids better in the doctor's office?
yeah, yeah. That's an excellent question. And to be honest, I've had my share of that experience. I know we often call it gaslighting, and I hesitate using that term because it feels negative. And I truly don't think doctors are being negative or being mean or don't care or any of that. I just think it's a lack of education on their part. And I very well could have been one of those doctors 20 years ago.
Mhm.
We just don't get that knowledge of what these kids are really going through um, in our education. So that's very unfortunate. As far as advocating, it's so hard. I don't want to minimize how hard it is. That's one of the reasons I do personally advocate, because both my husband and I are physicians, and for as hard as it has been for us, I can only fathom how hard it is for people that don't have that background or that knowledge or that experience, and my heart goes out to all those kids. So I would say trust yourself, trust your child, believe your child, number one. You're not only going to get doctors telling you, like, nothing's wrong, you're going to get family members and friends and everyone around you. So it's going to get it's going to be hard not to keep doubting yourself,
Mhm.
right? So I would say number one, just stay strong in your own beliefs and your resolution that yes, there is something wrong with my child. If your doctors are not taking you seriously, then you may need to find different doctors. I don't think it's our job as patients to educate our doctors or to tell them how to treat us, right? I mean, yes, of course, if they're open to it, if they say, I don't know what long COVID is, but I'll learn about it or I'll look into it or whatever it may be, that's great. They're open to it. But if they're just being dismissive, I don't know if that's the right doctor. And, right now with our groups, with things like Dysautonomia International, and there is more awareness, I do think that there's more opportunity to try to find doctors that can be helpful. Um, Most importantly, I would say with doctors and like with school, it's just knowing that it's just not giving up,
Yeah.
and not taking that doctor's advice of, oh, they're going to be okay, when deep down there's something wrong, even if no one can figure it out. Um, Go with your gut. No one knows your child better than you. So it's not easy by any means. It's not, the medical system hasn't made it available, unfortunately. But I think it's our job as parents to not give up and keep looking and keep searching. Um, and you really need just that one provider that's going to kind of be in it with you.
I think what I hear you saying is the necessity of forging a relationship with a provider, even if they don't understand. We didn't at the time my daughter got sick, we didn't have a pediatrician in our community, and so we drove 5 hours away, and I asked the pediatrician, "Have you seen this before, kids who just get sick all the time?" Because for my daughter, it appeared as if her immune system wasn't turning off, but of course, all of her blood work looked beautiful, and, his response to me was, "You know what? You just need to get her back in school. Just get her back in school." And I'm an educator, and I so desperately wanted her to be back in school. What would you
Yeah.
say? I agree with you. I think doctors aren't in the business of wanting to harm children. I think they want to do well by our children, but a lack of curiosity can be damaging and harmful. And what would you say to a parent who might be getting advice like just send your kid back to school when it could be harmful for the child?
Right. Um, I think it's just a matter of, again, trusting your gut. I,
Mm,
I, I think you have to, in that situation, maybe put your own thoughts above the expert advice. And I don't say that very often, of course, right? There's so many things that we don't want to research on our own because we want to count on the experts to help us. But again, if you're dealing with something that your doctor is not familiar with, you may know more about it than they do. You can always bring information to the doctor, like here's some papers I found, here's some articles I read, and share that. That's plentiful. I mean, honestly, you can search AI and find articles to support what you
mhm,
need right now. It's not hard to get to the information, right? Like
mhm.
we doctors can do it as well if, like you said, they have the curiosity. Um, Again, to your point of doctors aren't trying to harm children, they're in a medical system where they're seeing 30 patients a day, maybe 10-minute visits, 15-minute visits. It doesn't lend itself to the chronic illness care that these children need.
Mhm.
So that's unfortunate, right? There's so many obstacles that the chronic illness community is facing, and I acknowledge that. So it's really just taking it on ourselves as much as we can. And I guess with our kids, at least we have, the parents who, unfortunately, they may be ill as well. I mean, there's many in the community who are suffering through long COVID along with their kids, and that's heartbreaking as well. But hopefully with kids, we do have some caretakers that can take that on and do a little bit of the research and say, hey, this is something real. This is what's going on. This is what's not recommended or what is recommended. Um, I have found ancillary services to be really helpful as well. So if you can find a physical therapist that's familiar with things like dysautonomia and POTS, and hopefully long COVID, I know it's not all exactly the same, but they can be helpful in assessing and managing and not pushing,
Mhm.
which is what we experienced with our first round of illness, is that slow return back to school and the pacing. Um, Pacing in and of itself, I used to give that advice to parents when I was practicing, and now I realize how awful that was. What does pacing mean? If you have a child that's been going to school full time and doing maybe up to 2 hours of activities a day after that, what do what do we do now? Do we say now you do an hour activity, now you go to school for an hour, now you go, like, it's such a it's just something we say and we throw around, but what does that mean exactly? And that's where I think the help of physical therapists or occupational therapists are really important, that again are knowledgeable in that field. That's the hard part, right? You can't just go to someone that doesn't understand this illness.
Mhm. Absolutely.
And, yeah, and I think that's where we're all getting stuck, that there's not enough of those people maybe across the country available.
What kind of training do you wish doctors were getting to better treat the chronic illness community?
I think one misnomer is that people will just get better.
Mhm.
And if you don't get better, that somehow the patient's not doing the right thing.
Mhm.
And, if they just paced and exercised and slowly did the things, they would get better.
Mhm.
I think that's a huge message that I received in the medical field, in my training with POTS. I think the most I learned was they need to drink more water and electrolytes. Um, that's not accurate in any way of what POTS really represents. Um, yeah, so better knowledge, better understanding, more breadth of knowledge within each illness. And I don't think everyone gets better on their own. Like I said, I feel like we have two very different illnesses. One in which I don't think it mattered exactly what we did the first time. I think her body slowly recovered. And then a second illness where we just haven't been able to get out of it. Now, I know I'm fortunate and I'm grateful that she's able to go to school part time. I know many kids are bedbound. So there's that, but we haven't really moved the needle for her as far as where she started from this illness to where we are
Mhm.
now. So something is preventing that, right? Because we're doing all the things. She's still going
Mhm.
to school, she's still playing her sport, she is exercising, so we're missing something, right? And I think every patient, every child, everyone is different, which is what makes this so complicated and so confusing. Where one child may benefit from going back to gradual exercise, and one child may not.
Mhm.
And we can't put everybody needs to rest and everybody needs to exercise and everybody. So we need to figure out which kids need what at what point, which I just said something that's beyond
Mhm.
any information we have available to us now, obviously, but that's what we need. So what do we do in the meanwhile? We have to use the information that we have. So, like the heart rate monitors, or just our kids, the PEM, the post-exertional malaise, did this activity bring on a crash or did it not? Or can we go a little bit more, or do we have to pull back? Trial and error, basically, which is everything in this illness right now is trial and error. All the treatments, everything. So that is the best we've got, but I don't think making an assumption with every child before we know is appropriate either. Um,
I agree with
yeah,
that.
yeah.
Do you think the fact that you're a doctor was protective of your daughter in the sense that your knowledge was trusted by other doctors and it maybe prevented your daughter from being treated as if it was in her head or you were encouraging her being sick? Was it protective in that way?
Yes.
Okay.
Yes, definitely initially, we did not get a lot of pushback, and I mean, to be fair, we even said she was hospitalized for her headaches, and we said, "Can we get a psych consult?"
Mhm.
Like, we asked for it, right? We're like,
Mhm.
"Look, we're not trying to we wanna cover all the bases," you
Mhm.
know? If something's going on that we don't know about, um, we want her to talk to someone and figure that out as well. So we were not put in this category of like, oh, it's just anxiety, oh, it's just,
Mhm.
you know, um, social, whatever it may be,
Mhm.
depression, things of that nature. So I am grateful for that. I think that helped us at school as well, where we did get the accommodations pretty easily and people understood.
Mhm.
So yeah, I do think that having that background was helpful in that sense, which again is why I my heart breaks for the kids that don't have it because that's not right.
One doctor told me that and she was referring to MECFS, but that it tends to strike middle class families
Mhm.
white families who are established and their kids might be perfectionists. And I
Mhm.
remember thinking, well, maybe we just have the resources to be able to show up and ask these questions. And I
Yeah,
worry a lot about the people who don't have resources. Chronic absenteeism is still a problem in our country, and I see that a large subtext there that there's kids that are sick that aren't getting treated potentially. And
yeah,
again, we
yeah.
don't know.
Yeah, I share that concern with you 100%, and I have often thought about that. Her first doctor, the long COVID clinic, said that, you know, it's the higher performing kids
Mhm.
that tend to be affected, which I thought was really interesting. Um, we don't know. Like you
Yeah.
said, we don't know enough about that to really put it all together. I mean, there is the neurodivergence aspect that there's been some connection with chronic illness and neurodivergence. So, yeah, I mean, if you have some mild inflammation causing neurodivergence, right? Then something comes and makes it a lot worse. So,
Mhm.
I do think there could be some connections with the idea of the kid that's high achieving and the perfectionist and the, you know, but we don't know enough about it yet
Mhm.
to say that. And I share your concern about the kids whose parents just don't have the resources and
Mhm.
don't know, and honestly, that think their kids just being lazy or school
Yeah.
avoidant, or they're just depressed and is not seeking care, or the care they seek is telling them that there's nothing wrong.
Mhm.
So yeah, I don't think we know enough at this point. Um, like
One
you
of the
said.
things that has surprised me so much is the online communities that we're both in and how
Mm.
helpful they are. I never would have thought that I would crowdsource care for my child or different treatments. You know, on the one hand,
Yeah,
I'm so grateful for the wisdom of
yeah,
other parents sharing. It also is pretty scary, right?
yeah,
Because and there's really often great guardrails of people coming on and saying that something might be unsafe. But in a landscape where there is no FDA approved treatments, where the research on children specifically is really limited and parents are left to do their own research and
yep,
they're left to do their own uh, not just caregiving, but case management.
yep,
How h how do parents safely navigate the terrain? Because some of the treatments we go for, doctors, one, told us not to follow. You we were
yep,
at first discouraged from trying things like low-dose naltrexone and low-dose Abilify, which, as far as, seem to be like low-hanging fruit to try for our
Yeah,
kids, right?
yeah,
So
yeah.
anyways, I know it's a big question, but how do parents safely navigate all of that?
Oh God, that's wow, $1 million question. Honestly, Mercedes, it's again, without that knowledge, that's where my heart really lies for the people that are trying to figure this out. I think that's where you do have to really search for that trusted doctor that even if they're not completely familiar with long COVID, because let's face it, not many are they willing to learn? Are they
Mhm,
willing to walk with you and at least say, okay, we can try this, you know? Um, Even as a pediatrician, I 100% had to have those people in my corner because as a mom, I did not want to make all those decisions for my child. Even though, as you said, we do become the case managers often, and I have to decide like which treatment are we going to try next. I almost always will try to get at least one doctor on board with my decision, if not all of them. Right? We have multiple now um, that think that idea is okay or not okay, or why it's not okay. Because that's a lot to take on as a parent to decide what to try next. And obviously, you need a doctor to prescribe it for you. So I'd say really search for that one um, physician in your corner,
mhm.
that you can at least bounce stuff off of and help you decide if this makes sense or not. Now they're trialing LDN in kids as young as 6, I believe,
Mhm.
um, is the study. So we know that it will become more readily available, and the studies hopefully will show that it is safe and something worth trying. But that's just one drug, like you said. There's other, those are low hanging fruit. There's other things that we hope that doctors will start trialing in kids, especially adolescents, because really there's nothing magical about 18.
Mhm.
Nothing happens in your body once you turn 18. Once you're post-pubertal, um, you pretty much can follow adult
Mhm.
guidelines. So hopefully doctors will start to feel more comfortable with that.
What is reasonable to ask a primary care physician to screen for in the chronic illness community? And I'm thinking of, for example, post-exertional malaise. When I learned what it was, I started crying because I realized that's what my daughter had, and I realized that it had all these other implications. And now, 3 years out, I wonder, is screening for post-exertional malaise in the doctor's office for a child appropriate when they're facing, a constellation of these, oddball symptoms and they're just not getting well?
Yeah, absolutely. I think it's very much a hallmark of, I mean, I know it's chronic fatigue syndrome, myalgic encephalitis, right? The MECFS, but I think we have to monitor that in any time that you're presenting with these, like you said, these oddball symptoms. They come and go, they're not consistent. Um, I think oftentimes parents will describe a crash, right? Like my kid crashed, things got worse. So those are clues for sure
Mhm.
that something is causing this and that we have to be more mindful of it. Um, Again, that's just finding the people that are a little bit more knowledgeable about this, that are willing to learn. I don't think, yes, you should take, not that you should, we have to as parents learn about this, right? There is no
Mhm.
other choice. We have to try to understand the illness as best we can. But I do think it's important to find someone that is willing to walk this walk with you.
How do you think we can best help our kids who are experiencing chronic illness? And I mean that in the broadest, way possible, both
Yeah.
educationally, medically, in our families.
Yeah. Honestly, I think number one is to believe them, is
Mhm.
to believe when they say, I can't get out of bed, or I can't do this, or I can't concentrate, or this hurts, or whatever it may be. I think really just to fully believe what they are saying, and to for us to accept it. I know for me it was very hard, right? To just be there for my child and accept what's going on, and they need to know. And I say this as a parent coach, and as a pediatrician and as a mom, not just for chronic illness, but for everything. When our kids are going through something really awful, they need to know that as parents, we can handle it,
Mm-hmm.
right? They can share the burden with us. So if we're having a hard time handling it, we got to figure out how we can expand our tolerance, our resilience, our ability to be there for them,
Mm-hmm.
um, so that they can share that burden with us.
Mm-hmm. I expected my daughter to just get well. It was a slow onset, and I believed her, but I just thought we had to wait a little bit longer. And I'm sharing this because I think kids first have to get past the barrier of their parents, right? For their
Yeah,
parents to buy in on how sick they are. And then they have to get past the barrier of the medical system. When a mom or dad is bringing their kid in to the doctor's office, what should they be sharing about their child's medical spectrum? And I ask because there were things I never thought of sharing that I thought were just oddball things. For example, my daughter's skin started erupting in hives when she showered, even with just plain water. And now I realize that was probably mast cell activation syndrome. But
right.
I, at the time, didn't share everything, in part because as that file got thicker, I became apprehensive that the more I shared, that
Yeah.
that I was putting my child at risk.
Well, so my question to you though would be, do you think that once you found the right doctors and you were able to share that they appreciated that information, versus again the doctors that maybe weren't willing to hear you out or didn't quite understand what's going on, then that information may have been superfluous.
Yes, and, by that point, there was one local doctor who was really wonderful, and it just never came up, and then we wound up getting a private pay doctor out of state, and I just know that's beyond the resources, and even the doctor we saw locally, for whatever reasons, we were kind of seeing them on the side, and, it just it was just really tricky. At one point, my daughter was hospitalized with strep, and that was the moment we said, "Do you believe us now? Something's really not right." And it was actually at that time that we met this doctor who
Mhm.
sat down and read her whole file, and it was the first time we felt affirmed. But it took a hospitalization, and it was only her first that year, and I just wish that things didn't have to accelerate like that in order for
Right,
families to be taken seriously.
right. 100%. Yeah, it is very unfortunate. Um, the resources are scarce right now. They really are. It may be counting on the community,
Mhm,
right? Whether it's Facebook or whatever you may have found. Um, Not necessarily doing things, but at least with taking that information, knowing that information, taking that to your doctor to review with them. But yeah, I would say keep searching for that doctor as soon as you know something is going on.
mhm,
And that is so much easier said than done for many reasons. But I know as parents, first of all, we're not checking for COVID anymore, right? If your child is sick, you assume they have whatever illness is going around. They could get better in 2, 3 days. They go back to school and that's it. Or they barely have a sniffle. And then, 4 to 8 weeks later, they may come down with this, and you may never ever put that together. So I think that's one thing that's very hard right now.
mhm.
Um, so then you may not even be thinking long COVID. And then all of a sudden, your kid has these weird symptoms again that come and go. So then most people are going to think, okay, well, maybe something's going on at school. Maybe they are depressed. Maybe it is. That's a very normal thought. I think what we all need to do, and hopefully things like your podcast and other podcasts and the information we share, is every doctor and every parent needs to have long COVID on their differential anytime a child is coming in with vague symptoms.
Mhm.
Period. I'm not saying that's what it is every time, but if we don't look for it, we're not going to find it.
Mhm.
And every doctor should now have a resource for long COVID.
Mhm.
So if they're not the ones that are going to take care of you, they should then have someone in the community or be able to reach out to someone to say, here's some doctors for you that could help. I say should, of course. I don't know if that's happening, but I really hope that that is the path that we're on. Um, you know, as parents, I think if you have a new onset school avoidance, right? I think that's going to be the first thing. Kids are just going to say, I don't want to go to school. I don't feel good. I'm tired. Um, they may, especially if they can't do things that they used to enjoy. I
Mhm.
think that's a huge red flag. Like our daughter, at the beginning of this illness, we were going to Knott's Berry Farm, and she said, "No, I can't go." Huge red flag,
Mhm.
right? I mean, that's something she enjoys immensely. Um, Even if it's like, oh, well, they're just sick on school days and not sick on the weekends. Well, school days are more stressful, and you do have to get up earlier, and so yes, it does make sense that they're having a harder time. Don't just assume it's anxiety and leave it at that.
Mhm.
So I think as parents, we just have to be a little bit more investigative,
Mhm.
um, especially if there's a change.
Mhm. Circling back to something you mentioned at the start of the conversation was your son. And I'm curious how this 4 years is a long time to navigate this kind of illness. How has it impacted your family dynamics? And how have you continued to be able to meet your son's needs?
Yeah, I think we're fortunate in that my son was older,
Okay.
so he was a little bit more independent and could do more things, and he could even help us at times. So I think that was helpful for us. And we were just very open with him. I did not want to put the burden on him ever.
Mhm.
Like you have to take care of your sister, you have to do ever. And we really try to be there for him. So he also plays water polo. So when he had an event, I mean, there was times I had to miss. We were actually in Denver for one of his games, one of his bigger games, and so yes, there's sacrifices. You can't be at everything, as you know, but we really did try to be there for him as much as possible. Um, and maybe just kids being older for me made that a little bit more accessible.
Mhm.
If you have younger kids, I feel for you. It's a lot. At that point, you just really need to hopefully find support. I mean, I know people move to be closer with families when
Mhm.
they're dealing with chronic illness because you just need that support. You need the grandparents or the aunts and uncles or people nearby. I'd also say, ask for what you need. I think that we're so bad at that. And I do think friends will come out and support you if they know how.
Yeah.
I think a lot of times people don't know how. And unfortunately, with chronic illness, it's so ambiguous and it's so hard to understand. I mean, I can't tell you how often people will see my child and say, wow, she looks great, which I know they mean as a compliment and they mean it to be, as a good thing because they know what's going on with her. But at the same time, it's like, yeah, but you don't really see all the things that's happening
Yeah.
when she's not out, right?
Yeah.
So I think that's confusing to people.
Mhm.
Um, this, you look good, but you're really not good, and you're really sick, but you're not sick, and you're at school, but you're not at school. So it's, they don't realize how they could be helpful because it just, without being in it, I don't people don't understand it. And I don't want people to understand it, to be honest. I don't want other people to go through this. But I think it's on us to try to ask that, this would be very helpful, or can you pick up my other kid? Um, Certainly, maybe not for your sick child. I feel like I really need to be there for her. It's not
Mhm.
something I can pass on to other people, right? With the medications and doctor's appointments, and that's where we need to be. But for your healthy children, for sure, it's asking friends to give them rides or pick them up, or if they have do sports with other friends, things of that nature.
Mhm.
I think that's where we need to try to get that support.
And I do think there are ways to invite people into your inner circle to help with your sick kiddo. I work full time and my husband works full time, and we really needed my health insurance. And so we had a rotating cast of characters, 2 or 3 people who would come in and just hang and watch movies with my kiddo
Yeah.
while we worked, and it kind of broke the isolation up. It helped other people understand what we were living through, and I was apprehensive, but it was something that we had to do, and it wound up being really beneficial because through that, my daughter was able to keep relationships and develop relationships that she wouldn't
Mhm.
have had. And she
Yeah.
missed significant stretches of her elementary school, but she had these other experiences as well. I know that you are a part of a nonprofit, Long COVID Families. Can you tell me about that?
Yeah, so after her second bout, I really felt like, okay, I need to make something good out of this,
Mhm.
between my personal and professional experience. Like, how can I help with this? How can I help all these other kids going through this? The JAMA article that came out not too long ago about the 6 million kids in the US making it the most common chronic illness. So I was connected with long COVID families, and I reached out to them and just offered my support. They are the only advocacy group for kids in the US.
Mhm.
So they're in a unique position, to advocate for kids, have some connections with pediatric long COVID physicians that are doing the research, um, connections to the NIH and the Recover program. So there is a lot of behind the scenes where the founder, Megan Carmeleni, who had her own um, bouts of chronic illness as a child, can help in many ways. And,
Mhm.
and she knew that COVID would do a lot of things that
Mhm.
she went through
Mhm.
that would happen to kids again, and that's where she kind of wanted to step in and try to help. So she has that personal experience, and with her advocacy, she's been able to get in with the right places. You know, we can't count on advocacy groups in other countries because it's just so different how our systems work. So
Mhm.
I do think it's very important to have something US based,
Mhm.
and meeting with our politicians and helping them understand what's happening, right? Because again, I don't think they do, to be honest. I think most of them don't realize how badly it's affecting kids.
Mhm.
So that's where we come in, is just to try to bridge that gap as much as possible. Helping with school, I know we've reached out to like the LA school district, which is the biggest one, and I think one of the biggest, if not the biggest in the country. And a lot of schools will follow their what they do.
Mhm.
So if they have policies in place, then we can point to them as far as the long COVID and things like that. So it's all very tedious and slow
And
and
necessary.
and necessary. But for me, it's hard because I'm the type of person that wants things done yesterday.
Yeah.
So that patience is hard for me. But we're getting there. We're getting there, and more research is coming out on kids specifically.
And are so you're doing a lot on the policy level. Do you do anything directly with parents?
Oh yeah,
Okay.
yeah. That is the goal, is for parents to have a place to go, to have a hub, where they can also interact. We're trying to. There's a pilot project to start opening that up. So not Facebook necessarily, but more of a social online setting for
Mhm.
parents to connect with a moderator and get some answers, and maybe even do it by cities and by location, so people can connect in their communities, which I think is also very important. And resources for school,
Mhm.
right? A lot of, I think, yes, like I want the cure just like you, right? Like,
Mhm.
again, I wanted it yesterday. But in the meantime, how are kids going to live with this? How are they going to get the education they need? Find the relationships and the support, and the parents finding the support that they need to live with what they're experiencing. So, for sure, that's something that we're working on as well.
That's great. Thank you so much for doing that work. It's so necessary and it's so tedious, like you said, because the systems are just so slow moving that as you were talking, I was thinking, what do you envision for our kids in 10 years? I mean,
Oh man, I am really hopeful for a cure. I
yeah.
really am. I mean, and when I say cure, I mean, I don't mean like, they're going to take a pill and then it'll all be over, but a really, really viable treatment that
Mhm.
will bring their system back to homeostasis, which I think is what's wrong, or their systems are just out of balance, out of harmony. We will figure out in each individual what is that mechanism,
Mhm.
and we will have a treatment for it. That is my hope.
I like how you said in each individual because it does seem to be so specific to the individual, however, their systems go out of whack. And that's just one of the hardest things is that what works for one child or one person or one teen isn't necessarily a reliable pathway for the next person.
Right. Right. I really am hopeful. I see the research. I see all the mechanisms being reported, and I know we're working on biomarkers. I don't know of studies of biomarkers in kids
Mhm.
yet. There may be that I'm not aware of, but I think that will be the golden goose. I think once we can find the biomarkers, test those in each individual, say, okay, here's something we can follow. Then we can get big pharma involved, right? Because then they'll
Mhm.
have something to monitor as well. And I think things can go much faster at
Mhm.
that point.
Yeah.
Um, those are all my personal predictions. Take them as you will, but I am hopeful. I
Yeah.
am. And I
Um,
think we all need to keep pushing and prodding and posting and talking. Um, if there's 6 million kids in the US, let's say half of them know they have long COVID, roughly.
mhm.
That's a lot of people,
That's a lot of people.
right? Like we as parents can bring on policy change
Yeah.
if we keep pushing.
Yeah.
So, yeah, that's what I would say. Talk about it, tell people about it, call your legislators, call your congressmen, women, officials, and, you know, we need to move this along.
Yeah. Yeah. So, what is giving you hope this next week? Getting you through the next week?
Oh man, this next week's going to be a little tough.
Mm.
Um, what's giving me hope is that we have maybe found a couple things that could be helpful for my daughter right now. And I'm having very mixed feelings about this, and I'll go ahead and share. We decided to get her a PIC line, because she'll be getting quite a few IVs in the next month or so. And it's like a relief and heartbreaking at the same time.
Mhm.
Um, so the realization that she needs it is really hard.
Mhm.
But also thinking about the number of times she was going to get poked and have to get her veins and infusions was really hard also,
Mhm.
and so I think that's actually a really good summary of this disease. The hope and the joy and the grief and the sadness and the sorrow, they all live together
Yeah.
often.
Yeah.
um, and we have to take those moments of, I don't even want to say joy, although they can be very joyful, but it's moments of normalcy.
Mhm.
You know, I think one of the biggest gifts I've received is really appreciating the mundane. And I mean, like, really appreciating the mundane. Um, Sitting and watching a movie where she's not complaining of headache.
Mhm.
That's like heaven,
Yeah.
you know? Her going to school and not calling me to get her early, like, huge win. I mean, these are things that I think parents and I would have taken for granted all the time.
Mhm.
So it's now just this gift of like, today was a good day because it was ordinary.
Yeah. Dull moments are the best. We need more of them. And my
Yeah,
heart goes to you because I also feel that tension of the excitement of possibility that something might get better. But also, these kids have gone through so many treatments, and we
so
ask
much.
them to do so much. And maybe it works, but maybe it only works for a handful of moments and we're
Yeah,
back to the drawing board, and so that constant hope and catastrophizing that kind of coexist all the time,
yeah,
and you just want the dull moment on the couch watching a movie. So,
yep.
I hope this next week that you get that moment. I hope you get many more dull moments, and I just wanna thank you so much for coming on today and for sharing your heart and your expertise. It will mean a lot to a lot of people.
Thank you. Thank you for having me. And yeah, I think we're in this together. I think this community is amazing. Um, I feel like I have best friends that I've never met in person
Yeah.
from the online world, but that support is so needed.
It is. It is. Thank you for being there for other parents as well and for chiming in and for your work that you do on the long COVID families.
Thank you.
Thank you.